Welcome to MDnews.com. I'm Charlie Milburn. We're coming to you from San Diego, California at the site of the American Hospital Association's Leadership Summit. One of the hot topics for medical executives here was electronic medical records. We spoke to several of them about the successes and the challenges that they faced in implementing this system. Take a look.
Well, St. Charles Health System is a four-hospital regional health system located in Central Oregon. We have had in the hospital setting both EMR and CPOE since October of 2004. So we've been pretty far along in our journey. We currently use the McKesson suite of products, the McKesson Horizon products, which includes also medication administration, reconciliation, barcoding, etc. On the ambulatory side, we are working with Allscripts to implement that solution both on the practice management and the EHR side with our ambulatory physicians. And we're spending a fair amount of time right now identifying a solution for HIE, hospital information exchanges, that really move the information from the ambulatory setting into the hospital setting and vice versa. Well, we have spent many years attempting to quantify what the return on investment is. And I'll be honest with you, it's very hard to do that. There's no single financial methodology that allows you to do that. So we're still pursuing how we quantify our investment and what that return means. And I think we're going to see it in two ways. Number one is there'll be some element of financial return on investment, but I think the ROI is more along the lines of quality and patient safety, like I mentioned before. And those sometimes can't be quantified, but actually they can be, depending on the payer systems that we see in the future, reducing your risk and so on and so forth. But we have not been able to put our finger yet on what that ROI is. What I can tell you, we've spent a lot of money on IT.
I think we're fortunate in the area that we live in. The physicians, 5 family practice physicians, they had an electronic medical record 3 years ago. And the hospital moved toward an electronic medical record, and it's actually, meaningful use. We can be there because we've already started down the road towards meaningful use. People that haven't done that, it's going to be more difficult for them to make the time frame and get to where they need to be. But it's increased the quality of care that we give, because now in the hospital, the physicians can see everything instantly, and they don't have to try to figure out where the lab was drawn and what is the lab result. They can get it from their office, they can get it from the hospital.
We've had a very active, from a hospital standpoint, we've had a very active EMR since 1997. And when we implemented one, we've had an active CPOE, which is currently doing about 35 to 40% of all the orders entered in the facility. Not all physicians are involved, but the majority of them are. And they're entering about 39 to 40% of all orders electronically. That's been in place now for about the last 4 to 5 years. With regard to hitting meaningful use, we're waiting to see how our product fares in that market, but we believe we're on track to achieve most of it. We have a large multi-specialty clinic across the street, which I'm also a member of and a board member of, and we've had an electronic health record which did not achieve e-prescribing meaningful use as we thought we could in the last year, and we're currently in the process of changing that out as we speak. We signed a contract last week for a much larger, more efficient record. I mean, I'm not sure that I can actually look at an exact return on investment. What we do know is that we've had significant improvement in the ability to manage and get a verbal order signed, which is a big joint commission requirement. We've been able to improve safety in terms of prescribing and do away with a lot of the handwriting issues physicians had when they do CPOE. So those things I think it's had a very significant return on the quality of care and the efficiency of care.
Well, our organization is determined to become completely paperless and have an electronic medical record. We've started with computerized physician order entry as the first step, and then we've added the other functions to that sequentially. And it's really been interesting that to get to computerized physician order entry, we've had to cajole and beg and threaten the medical staff, but the residents and fellows, the trainees in our organization, were easily the earliest adopters, and most of our teaching programs are at 100% compliance with the order entry part. And the rest of our medical staff is sort of being dragged along. There are obviously some innovative physicians who recognize its value and are champions of it, but by and large, it's the trainees that are most comfortable with it.
So now that we've heard what they have to say, we want to know what you think. Click on the link below that says share your perspective to let us know what you think about electronic medical records. Reporting in San Diego, this is Charlie Milburn for MDnews.com.